The majority of men with prostate cancer are able to postpone or forego severe therapies without reducing their chances of surviving. Based on updated findings from a long-running British research. Study participants who worked closely with their doctors to monitor their low to intermediate risk prostate cancers. A technique known as surveillance or active monitoring reduced their chances of consequences that might have a major impact on their quality of life, such as incontinence and erectile dysfunction. That can occur after severe treatment for the illness, but they had the same risks of dying from their tumors as men who underwent prostate surgery or received hormone blockers and radiation therapy. The good news is that if you're diagnosed with prostate cancer, don't panic and take your time to make a choice on how to proceed, said lead research author Dr. Freddie Hamdi. You may delay or avoid therapy without missing the possibility to cure in a big portion of patients, said Dr. Bruce Trock. Men are thoroughly screened and their risk appraised. Men whose prostate tumors are determined by testing to have high risk and high grade characteristics are not affected by the findings. According to Hamdi, these aggressive tumors, which make up 15% of all diagnoses of prostate cancer, nevertheless require quick treatment. For others, however, this study adds to a body of information demonstrating that monitoring prostate tumors is frequently the best course of action. What I take away from this is the safety of undertaking active monitoring in patients, said Dr. Samuel Haywood. A prevalent cancer that is generally low risk after non-melanoma skin cancers, prostate cancer is the second most frequent cancer among males in the U.S. According to the National Cancer Institute, approximately 11% or 1 in 9 Americans will develop prostate cancer during their lifetime, and generally approximately 2.5 or 1 in 41 will pass away from it. About $10 billion is spent treating prostate cancer in the U.S. each year. Most prostate cancers grow slowly. It normally takes at least 10 years for a tumor limited to the prostate to generate substantial symptoms. This study, which has been ongoing for more than 20 years, supports what many medical professionals and academics have learned through time. The majority of prostate cancers detected by blood tests that check for prostate-specific antigens, PSA levels, won't impact men in their lifetimes and don't require treatment. Dr. Oliver Sartor advised men to realize that since the study's inception in 1999, that a lot has changed and medical professionals have improved their method of diagnosis. I wanted to make it very clear that the way these patients are screened, biopsied, and randomized is very, very different from how these same patients might have been screened, biopsied, and randomized today, said Sartor. According to him, the guys who participated in the trial were largely low risk and had cancer that was still in its early stages. By the way, be sure to check out my other new video on the new ISO PSA test that's a large improvement on men's testing for prostate cancer. That video is called Men Problem Urinating. Now, back to our video. According to him, doctors now have access to additional resources such as genetic testing and MRI imaging, which may assist direct therapy and reduce overdiagnosis. According to the study's authors, they reevaluated their patients using current techniques for classifying prostate tumors in order to allay worries that their findings would not be applicable to individuals today. By those criteria, around 1/3 of their patients would have a high or intermediate risk condition, but this didn't affect the findings. When fewer treatments results in greater care. Men were routinely subjected to PSA screening when the trial started in 1999. Numerous medical professionals advised their male patients over 50 to have yearly PSA screenings. PSA tests are specific but not very sensitive. PSA levels can increase by cancer, but they can also be increased by infections, sexual activity, and even bicycling. In order to ascertain the reason of elevated PSA testing, more investigation is necessary, which may involve imaging and biopsies. Most of the time, all of the follow-up just isn't worth it. Most experts believe that only approximately 30% of those with increased PSA will really get cancer. And of those who do have cancer, most don't require treatment, added Sartor. Studies and computer simulations have demonstrated over time that utilizing routine PSA testing to check for prostate cancer might do more damage than good. According to some estimates, regular screening can detect up to 84% of men with prostate cancer. Do not gain anything from having their tumors discovered, since before they died from other reasons, their cancer would not have been lethal. Other studies have estimated about 1 in 2 in every 5 men diagnosed with prostate cancer is overtreated. The negative effects of excessive prostate cancer therapy are widely known and include incontinence, erectile dysfunction, and sexual potency loss, as well as anxiety and sadness. The prominent U.S. Preventative Services Task Group recommended against PSA testing for healthy men in 2012, stating that the risks exceed the advantages of screening. The task force now takes a more customized approach, recommending that men between the ages of 55 and 69 decide whether to get routine PSA testing. After carefully assessing the advantages and disadvantages with their physician, they advocate avoiding PSA-based screening for males beyond the age of 70. The American Cancer Society supports a similar strategy and advises men at average risk to discuss the advantages and disadvantages with their doctor, starting at age 50. More than 1,600 men who had prostate cancer diagnosis in the UK between 1999 and 2009 have been monitored by the experiment. All of the guys had cancer, but it had not spread to other regions of their bodies or metastasized. The men were randomly allocated to one of 3 groups when they joined: active monitoring, frequent blood tests to check their PSA levels, or no monitoring at all. Radiotherapy, which reduced tumor size by using radiation, and hormone-blocking drugs, and prostatectomy, or prostate removal surgery. During the course of the research, men who were allocated monitoring had the option of switching groups if their malignancies advanced to the point where more aggressive treatment was required. Most of the males have been tracked for roughly 15 years now, and for the most current data analysis, researchers were able to acquire follow-up information on 98% of the participants. By 2020, 45 men, roughly 3% of the participants, had died of prostate cancer. There was no significant differences in prostate cancer fatalities across the 3 groups. Compared to the other groups, men in the active monitoring group had a higher likelihood of their cancer spreading and progressing. Compared to 5% in the other 2 groups, 9% of the men in active monitoring group experienced cancer metastasis. Chalk emphasizes that a growing cancer isn't a minor consequence, even though it didn't have an impact on their total survival. At that point, it may be unpleasant and need intensive therapies. Compared to surgery or radiation, active monitoring did offer some significant advantages. The researchers discovered that 1 in 4 to 1 in 5 men who underwent prostate surgery were required to wear at least one pad each day to prevent pee leaks when they were monitored over a 12-year period. According to Dr. Jenny Donovan, who oversaw the research on patient-reported outcomes following therapy, that rate was twice as high as other groups. Sexual function was impacted too. It's common for sexual function to deteriorate in males with age. Thus, towards the conclusion of the trial, virtually all men reported reduced sexual function. Nevertheless, she noted that depending on how their prostate cancer was treated, their pattern of decline varied. The guys who undergo surgery have decreased sexual function early on, and that persists. The males in the radiation group have a deterioration in their sexual function, followed by a period of partial recovery. And the number of active monitors gradually decreases with time, Donovan said. Donovan added that when she delivers her findings to clinicians, they point out how much has changed since the research started. Some people would respond, "Oh, okay, but we have all these new technologies today, new therapies," she added. Including robot-assisted prostate operations, brachytherapy, and intensity-modulated radiation treatments. But really, other research has indicated that the impacts on these functional outcomes are quite comparable to the effects that we saw in our study, she added. Donovan and Hamby confer that men and their doctors should carefully assess the study's findings when they make treatment decisions.